Before we get started, I just wanted to remind everyone that this webinar is going to be recorded, and all of you should have been muted upon entry, but you do have the opportunity to unmute yourself. So please keep yourself on mute until we get towards the end of the presentation, and then if we have some time for questions and discussion and you want to unmute, you can do so at that time. In the meantime, there is a chat box, so please use the chat box to post any questions or comments that you have throughout the presentation. We do have over 100 people currently on the webinar, and that's growing. So we know there's going to be a lot of people here, so it will really help to eliminate background noise if everyone stays muted. So today's Break Exchange webinar will be presenting the preliminary results of the Supporting Caregivers during the COVID-19 Pandemic Survey. Webinar is going to be jointly presented by myself. I'm Kim Whitmore. I'm an assistant professor in the School of Nursing at the University of Wisconsin-Madison, and a colleague of mine, Susan. I'm wondering if you want to unmute and just introduce yourself real quickly.
Yes, good morning, everyone. I'm going to, I've joined in the research with Kim, who's the principal, and I'm going to share some information about the research and some of the findings. It's good to be here this morning.
And then I just got a message that you guys are seeing a little mark over where I have my chat box. Is that better? I moved it out of the way. So
yes, it's good.
Perfect. Okay, thank you. So thanks, Susan, for that introduction. We're also really excited that today's webinar is co-hosted by the Break Exchange as well as the ARCH National Respite Network and Resource Center. Our plan for today is to share a little bit about the Break Exchange for those who aren't familiar or members of the Break Exchange, and then we're going to talk for the bulk of the time about the survey that we conducted, and then end with some updates and how to get more involved. So the Break Exchange stands for Building Respite Evidence and Knowledge, and this is an international group of researchers, respite providers, agencies, and individuals who are really committed to building a culture of evidence-based respite care. The Break Exchange was started by a unique partnership between 4 organizations: ARCH, the National Respite Network and Resource Center, Shared Care Scotland, the School of Nursing at UW-Madison, and the International Short Break Association, or ISBA. Currently, we have 130 members from 13 countries who are part of the Break Exchange, and we hope that this will grow, especially after today's webinar, that many of you will decide to join the Break Exchange. There are many benefits to being a part of the Break Exchange. They are to connect, learn, share, and collaborate. So the opportunity to connect through the Break Exchange allows you to interact with a global network of researchers, respite providers, agencies, and individuals, and really use that as opportunities to learn about evidence-based respite care practices and research that is happening around the world. You'll also have the opportunity to share. So we really want to hear from you and use this as a platform for you to share the best practices and research that you're engaged with, and really feature your work and your programs in a variety of ways. We have a monthly e-newsletter, we have a web page that we can post information on, and we do present quarterly webinars like the one we have today. And then really the primary purpose of the Break Exchange is to encourage collaboration among our memberships. We really want people to be able to connect with one another so that you can use those opportunities and networks to do more formal evaluation and research related to respite care. And you have this opportunity to leverage the exchange by identifying a potential partner for your next project via our online searchable member database. So if you go onto our website, you can complete your member profile, and that will add you to that database so that you can find people around the world who are doing similar work, have similar interests with you, to begin to reach out and connect with them about potential project ideas. So now I want to share just a little bit of background. I think most people on this call have a general sense of what respite is, but I wanted to share this definition that was developed by the ARCH group by Jill Kagan and Ray Kirk, who led the research agenda for respite, because I love that this definition includes the latter statement, which says respite is planned or emergency services that provide a caregiver of a child or adult with a special need some time away from caregiving responsibilities for the child or adult and which result in some measurable improvement in the well-being of the caregiver, care recipient, and/or family system. And I think that latter statement is really important. For those of you who are joining us from other countries, you probably know that we call this respite. In many other countries, they call this short break. So I just wanted to mention for the duration of the presentation, we will be using the term respite. And we know that respite services can be provided in a variety of settings, in the home, in the community, and in facility-based organizations. It can be provided to individuals with a range of disabilities and special needs, and also across the lifespan, from children with special healthcare needs to aging adults. And there are really unique aspects of respite services that are important for the context of this presentation. The first is that respite care is really relationship-based. It really takes intimate relationships and trust between people to be able to provide respite, and especially to see those positive outcomes of respite, to make it more than just a separation of a caregiver from the person they're caring with. And respite services are typically and traditionally face-to-face. And so this presents a really unique challenge in the midst of this COVID-19 pandemic. So as many of you are, have gone through and are currently going through, this COVID-19 pandemic has resulted in an immense amount of social isolation due to stay-at-home orders, due to businesses closing, unemployment. And so you have family caregivers who are often spending more time in the home with the people that they are caring for. And this can increase their stress and strain in that caregiving relationship. So we actually have sort of a perfect storm of having an increased need for respite services because of those increased demands on caregivers, at the same time that we often have the decreased ability to provide traditional respite services because of those same reasons, that many organizations have had to shut down or reduce their services, or there's inability to provide the traditional respite services that we have. So we really wanted to get a sense from our global community about how this pandemic was really impacting their services. And so we decided to conduct this online survey that ran for about a month, from March 31st through May 1st. And in that survey, we really wanted to understand the global impact of the pandemic on respite care services and use that as an opportunity to identify best practices for supporting caregivers during this time. When individuals completed the survey, they did have the option to complete a more comprehensive break exchange survey after they completed the COVID questions. And we had 44 individuals who chose to complete that comprehensive survey. And I will talk towards the end of the presentation about the opportunity to continue to complete that survey if you didn't get a chance to do so. So the COVID survey is what we're going to focus on for today. And that was a really short aspect of the larger survey that included demographic information as listed here and 3 open-ended questions. The first question asked respondents to describe the impact of the COVID-19 pandemic on respite services in their country, region, or organization, and to include how your country, region, or organization responded and adapted to support caregivers during this time. The second question was really a specific ask for examples of best practices, innovative ideas, communications, or other resources that individuals felt might be helpful to share with others to better support caregivers during this time. So we originally asked for survey respondents to email those to us, but we weren't getting a lot of emails from that. So we edited that statement in the online survey after about a week to include the opportunity to describe those below, so that we could have people share links and information about resources directly within the survey. And then the third question, which actually elicited a lot of response, was a very general open-ended question asking for additional information or comments about the survey from individuals. So really those 3 questions are what framed out all of the qualitative narrative that we were able to use and analyze as we present the results to you today. So I want to acknowledge our analysis team. So we had a small but mighty group from the School of Nursing as well as from Arch who worked together to complete the analysis for this project. So we have Tyler Engel, who is my amazing lab manager at the School of Nursing, Hannah, who is an undergraduate nursing student, Danny, who is a recent graduate of our undergraduate nursing program and had been working on my research team for quite a bit, Susan, who introduced herself earlier, as well as myself. And so I'm going to pass it over to Susan to just share a little bit about the process we used for analysis.
So good morning again. For those of you who aren't researchers, I'll just make this simple. What we did, it was called a content analysis. So remember we had the 3 questions. They were all open-ended, but 2 were focused. One on the impact in the context of where you live in your communities and countries. The second was an example of what you're doing in response to that impact, and then totally open-ended additional comments. So the reason that we use an open-ended approach is that in qualitative research, and particularly in a time like this where things are really fluid, we want to discover. We don't really have a firm idea of what we're going to see. So we ask open-ended questions. We use an iterative and recursive process. And what that means really is that we just repeat the analysis and we go back to those beginning questions. We circle back around. So there's a repeated process of coding and trying to understand. And for those of you who aren't researchers, a similar thing is like the first time you read something, maybe it's a kind of challenging article you read in a journal, you get something out of it. But when you go back for a second or third read, you unpack it, you understand more clearly the significance of what they're saying, not just what they're saying, but the significance of what they're saying. And you develop your own ideas and opinions based on that. So as we code, we generate propositional statements. This is what we think is going on. And then we try and challenge those statements with data, your words, those of you who responded, or we support those propositions. And then we explore for further understanding. We ask questions about, again, why is this significance? Does it really mean this? So we started with a list of a priori codes and things that looked at like funding, changes in services, concerns about care recipients, any challenges and barriers. And we had individual codes for these. And as we coded, we realized that the codes didn't quite capture in a more refined sense what we wanted to know, or those words didn't accurately convey what respondents in the survey conveyed. So those codes changed over time. We added more, we defined them more carefully, and then we would have to go back and recode. And then we would have weekly data analysis meetings to capture what we're finding and what the codes weren't accurately capturing. So we changed those. And then the data were coded again to check consistency and to expand our understanding. So it's a really simple process, but it's a rigorous process, and it got us to where we are now, discovering certain things that we think are important about what you all are doing. And that's it. Thank you.
Great, thank you, Susan. So next I want to just begin to present some of the preliminary results. So we originally had over 500 responses from 17 countries that completed, logged in for the survey, but after reviewing those responses, only about half were actually valid responses. There were a number that were blank, or they didn't respond to the COVID-19 questions for whatever reason. And then 5 were not completed by organizations, they were completed by individual caregivers. They were really insightful responses, but weren't really the target audience for this survey, so we removed those from our analysis. And so in the end, we had 244 responses that represented 15 different countries. The majority of the responses did come from the United States, but here's a map that shows the different countries that responded to this survey, and here is a list that shows the breakdown of those. So we had a pretty great number of countries that were represented in this survey. And then from the US perspective, this is a map that shows the states that responded, and in the bottom right corner, I listed those states that had more than 10 responses. Other states had 10 or less responses, but Alaska, California, Massachusetts, New York, and Wisconsin all had an increased number of responses compared to other states. And so we wanted to really share some of the key lessons that we're learning from this survey about the impact of the pandemic on respite and caregiving services. And we're framing that in 4 key areas. So the first is related to key challenges that organizations are facing. The second is how programs have adapted. And then thirdly, the new and innovative services that have been created in response to the pandemic. And then finally, sharing some helpful resources that survey respondents provided that we want to make sure we pass along to you. So I'm going to pass it back to Susan, who's going to share the results of the challenges.
So remember that we asked 3 questions, and the first was about the impact, and we asked about that in context. And so you'll see that in the responses. The other thing I want to remind you of is that this was essentially, the survey essentially occurred during April, and I live in Seattle, so things were pretty hot and pretty heated up and pretty fluid in April. So, one of the things we can't answer is how things have changed over time, and we're interested in that. But at the time we administered the survey, there were challenges in 4 areas: in safety, technology, difficult life circumstances, and organization and some bureaucracies. Next slide, please. So the challenges to safety. The first thing was that providers lacked access to PPE for themselves and their clients, and we saw this in the papers, right, for everybody. One of the things that we heard from some respondents was that they perceived that society didn't appreciate their work, and therefore access to PPE and their safety was not a priority, and that's consistent, I think, with what we're seeing at a national level and a number of occupations. A second, providers needed safety protocols and clear guidance in following those protocols. For some providers, when the guidance occurred from their leaders, it sometimes changed. It was verbal rather than in writing, and it didn't include training and TA. So what we saw were providers that really felt at sea, they felt uneasy, they felt fearful, and the guidance coming from the top wasn't clear. I have to say, at a national level, that was true also. That's consistent with what we see nationally, or saw nationally in April. Caregivers needed explicit safety guidelines for choosing to interact or interacting with service providers. Many caregivers refused service and lacked guidance about how and when to allow providers to re-enter their home. That's probably important right now because, as we said, this is respite or short breaks are relational, they're transactional, and you would want caregivers to have the information they need to make good judgments. And we really enter into a contract with caregivers as when providers enter the home. And so we need to flesh those out and make sure everybody's safe and everybody feels safe and knows how to proceed. And then programs and organizations need to anticipate and plan for emergency responses, including COVID-19 recurrences. So a surprising number of programs, surprising to me, responded rapidly, adeptly, but services languished for some programs that lacked a process for planning and proceeding. So a number of programs just talked about planning, but they couldn't kind of get off the dime. This is a quote from one of the surveys. COVID-19 in most of the state, some respite services are continuing, but all on a limited scale. Many agencies have stopped respite services entirely, either due to the shelter-in-place order, lack of available providers, limited access to personal protective equipment, and our families not feeling comfortable using services. So you could see that one quote kind of encapsulate everything that we talked about in terms of safety. In terms of technology, some organizations struggle to find and use technology. There was a short time to develop or adapt new service models. So there was a steep learning curve for programs, and some rose to the occasion and others struggled with that. Some caregivers and families needed access to computers and equipment, including adaptive technology for persons with disabilities. This is probably true today as it was in April. It probably will be true going forward. but a few of the few programs that responded just were amazing in terms of their finding equipment and teaching people to use it. Some caregivers and recipients needed explicit guidance and support in using technology. I have to say elder populations were mentioned often, and I guess that's okay to say because I'm an elder and my husband is too. My husband really needs help with technology, so that's just something to look out for. And then some providers struggled to find technology platforms that worked for their intended purposes. So there's not necessarily a match with the kind of work we do that is relational and Zoom meetings and FaceTime. There's something about that translation and the delay in time that doesn't necessarily work well cognitively and emotionally. For state policy, most caregiver and therapy services are not allowed to be provided through a telehealth format. It would help families if the states would approve the provision of caregiver and therapy services in a telehealth format. And this was one program. And one thing to point out in qualitative research is that every story is important, even if it's not the majority of what we find. I think this was more the exception than the rule. There were a lot of adaptations, but it is important to be able to adapt rules and regulations. Difficult life circumstances. Both families and providers reported feeling high levels of stress and worry. Providers reported feeling worry about families experiencing isolation. And this isn't one thing that we were looking for necessarily, but there's something called secondary trauma. Probably we're all feeling a bit of that in the United States right now, and that appears to be a real thing for providers. So not only do they feel stress and worry for themselves, but they really worry about the families that they work with. Meeting basic needs that came up with the majority of the programs, especially for food and medicine challenged families. And it really appears to me that the providers were essential in helping families meet basic needs, maybe more than any other organization. We can't say that for sure, but that's how it appears from the data that we're seeing. And families need information and support to use community resources. And awareness of this need was apparent when programs checked in with families during regularly scheduled calls. The quote, "The pandemic is terrible for our clients. We call to check on them weekly. We've received a couple of different COVID-19 grants to help with food and gas costs. We know it takes more food during this time to feed our families because the children are home. We're providing gas cards to help them go pick up free lunches and breakfast at the school for children. Our families are more isolated than they ever have been and they have the stress of homeschooling the children." And I just want to say something about this quote in terms of unpacking that what you see here is somebody that's really aware of a family's global needs and really caring about them, and immediately finds ways to respond to those needs and to support families that goes beyond what we traditionally think of as respite or short breaks. And then organizational and bureaucratic barriers. Some programs encountered inflexibility, time-consuming red tape, and in using funds for alternative and responsive service delivery models. And when this occurred, services were interrupted, and in some programs, staff furloughed. And this did not seem to be a dominant response, but it occurred multiple times. So in the quote, "There's been no workforce to deliver respite services. There has been inconsistent workforce to deliver supported living. No support for 3 weeks, support for only 3 of 5 days. As a family caregiver, there was no communication to families or family members." So I'll leave you with that uncomfortable quote, and we'll move on to how services adapted.
Great, thank you, Susan. So when we analyzed the data, it really became apparent that organizations, by and large, were able to adapt their services, and we've them sort of clustered in the following 4 main ways: around increasing communication, providing virtual support groups, changes in service location, and changes in funding. So for increased communication, we found that many organizations, as Susan alluded to, really made more calls to check in with clients above and beyond what they typically would have done because of their concerns of the increased needs of those that they were serving. and that those assessments were done really holistically. Again, not just what's your respite needs, but what are those basic needs that you have that aren't being met. And there was a huge number of organizations that increased or developed case management-based services and used that to help increase referrals and connections to other resources outside of respite care, which we thought was really powerful to recognize the organizations that are providing respite being able to sort of adapt and change to meet the growing needs of this population. So here are two short quotes. The first is, "We are making calls to ask everyone if they want more frequent check-ins, and staff has been on constant phone call support and guidance. Although helpful, it limits how much support the consumer receives. We use social media to promote and educate our community and consumers." For virtual support groups, we found many organizations held conference calls and other forms of virtual support groups, and those were really done across the lifespan. So one organization said, video calls with the children's helps. I know my son loves his Zoom meetings with his classmate. It really helps him feel connected. And so though there are barriers to video conferencing and supports, I think it is one tool that we do have the ability to use during these times. And then as the next quote alludes to, for many, it involved providing the technology to enable this to happen. So this organization said, "We have provided some clients and foster parents with laptops in order to be able to make contact with them." So making sure that if you are changing your services to those virtual platforms, that those that you're trying to reach actually have the capability, the internet access, and the devices to be able to make that connection was really important for many organizations. Many agencies also changed how they provide respite. As mentioned, many went to different online activities, and some center-based agencies went to in-home services. And so this was really important to have that flexibility. And what we did see, though, that was alluded to a little bit from Susan, is that not all organizations were able to make these adaptations as quickly as others or as easy as others, and those organizational bureaucracies were really a challenge to some organizations and how easily they could make some of these adaptations. And so making sure that you could have flexibility in the protocols and policies that you have within your organization to be adaptive in the service deliveries that you had was really important. There were lots of really unique creative online activities that were used as pseudo alternatives to respite, such as online yoga and other stress management type courses that were offered in the online format. Here are a couple quotes that speak to this. So first, "We offered in-home aid support as an alternative to those funded families who are without day program services. We are developing communication and support opportunities done remotely and will be scheduling some activities through a YouTube channel." And then another organization used live activities via Zoom, such as chair yoga, art, exercise, music, and more. So it was really neat to see how creative people were and how they were leveraging the technology available to them in different ways to connect with families. Next, there were changes in funding. So many programs and organizations were able to successfully repurpose funds. Again, that wasn't always the case. There were some organizational and bureaucratic barriers to that. But some programs also received new funding for initiatives, which allowed them to meet some of those needs. And a number of programs used existing funds for those alternative service models with their funders' permission. So here is one quote. "We offer micro grants to purchase a break of their choosing. These grants have been particularly useful during the pandemic, as caregivers are using grants very creatively to purchase equipment or subscriptions that can help them look after their health and well-being and have a little time out. Examples include magazine or movie channel subscription, board games, home exercise equipment, items for crafts and hobbies." So again, really thinking a little bit more holistically and broadly about how can we connect people to things that will give them that sense of a timeout, a break from their caregiving responsibilities. And then there were new services that we found that many organizations described having developed in response to the pandemic. And we found those really focused in the following 4 areas. The first being delivery of food, supplies, and meals, the use of internet platforms, providing additional caregiving support, and innovative ideas that were not mentioned by a large group, but were really stood out to us as things that we wanted to share because they were just so unique and creative that we thought they would be really beneficial to this group. So as far as the delivery of grocery supplies and meals, this was really common among organizations. Many used volunteers and community partners to do the shopping and deliver to homes. Many offered meals to caregivers in addition to care recipients to make sure that the whole family was able to be fed, recognizing that children were at home and different community-based activities are closed, and that it was really important to ensure that there was food for everyone in the family. And then several organizations delivered weekly sort of care packages that had a list of activities and supplies for them to do at home as well. Here's a quote. It says, "Most of these families do not have education, or they should not be out in public due to their age and health conditions or the health conditions of their grandchildren/relative children. We are addressing this issue by delivering food and supplies, cleaning diapers to the families directly, enough to last 2 weeks." Many organizations used a variety of internet platforms and created new services through these medias to try to reach caregivers and care recipients. There was a lot of talk about YouTube, creating and sharing existing videos that were related to providing care during the pandemic, as well as videos that provided different activities to help engage individuals while they were at home. There were lots of information posted on blogs and websites to just share information and resources to caregivers on how to adapt during the pandemic. And then lots of activity in social media, so support groups that allowed caregivers to share their experience and find a way to connect and try to overcome some isolation. And then quite a few that use social media to help address fear surrounding COVID-19. So recognizing that that was a big concern of many people that they were working with, they did a lot of outreach to try to reduce fear and help support the mental well-being of individuals during the pandemic. This quote says, "The center is also providing free programming, cognitive and physical stimulation on Facebook Live 3 times a day. These videos of word games, trivia, sing-along, and chair exercise are then posted on our YouTube channel and website for caregivers to watch with their loved ones with Alzheimer's and dementia when they please." And then caregiving support. Again, there was a lot of new services really designed to support caregivers in different ways besides just respite. So there were care packages for caregivers that had resources, supplies, and self-care items. There were different grants for caregivers to allow them to purchase equipment or subscriptions for activities. Lots of check-ins, as mentioned previously, with caregivers via phone and other platforms. And then what I found really interesting was there was this increased effort for both appreciation and recognition of caregivers and employees. So many organizations that really recognize the toll that this pandemic and all the change and uncertainty has had on individuals that work for their agencies and organizations, and just really being a more constant presence and almost a cheerleader to help boost people's mindsets and mental health during this time, which I think is really important still today, and is really great to see so many people have been able to do that. Here's a quote that captures a little bit of this. It says, "We are currently sending caregivers a weekly sheet of activities that they can do with their loved one at home. These have been well received. We also have a team of volunteers calling each caregiver once per week to see how they are coping." And then finally, under new services, we have the innovative ideas category. So many organizations mentioned trying to meet those basic needs, and some did that through fundraisers and actually raising money to help support families financially during this time. Many were making face masks for consumers and their families. A few were doing online music therapy. There were some emergency programs to allow consumers to hire caregivers in emergency situations. And then this last one I found really fascinating. There was a couple organizations that mentioned the use of electronic e-pets and robotic animals to help with isolation. So here's a quote that says, "We are offering the idea of purchasing electronic pets for those in nursing homes who cannot have their caregivers and family members visit." So I thought that was just a really creative idea. So the last key lessons that we wanted to share with you related to the survey was surrounding resources that were shared. So again, in the survey, we asked specifically for people to share ideas and helpful resources that they had, and these sort of clustered in the following 4 areas. There was a lot of people that shared that they've leveraged public health department information, whether that was local, state, or national information, or emergency management type information and websites to stay up to date. There was a lot of COVID-19 information that was hosted on the websites for national associations, such as the Alzheimer's Association, that was shared as a good resource. Many shared mental health and wellness information, recognizing how important that was and resources that they found. And then there was many that shared different YouTube videos and trainings that they found helpful. And so we will be providing a full list of all the resources that were referenced in the survey, and that will be available on our website shortly. So as we think about the preliminary results of the survey, what really stood out to our analysis team were the following. We really felt that despite numerous challenges, many organizations have been able to adapt their services or create new services to continue to support caregivers. And most organizations, rightfully so, prioritize supporting the basic needs and mental health of caregivers, families, and staff during this time. When they weren't able to provide traditional respite services, they found other ways to help support caregivers. And the organizations that were most successful were able to plan and adapt quickly and appeared to have good leadership and support. We do want to recognize that there are some limitations to this study. First, what we're presenting here are preliminary results. We do have still quite a bit of data to go through and other key findings that may emerge as we continue to do our analysis. And then, as Susan mentioned previously, these responses were collected at a single point of time. And we know that the impact of the pandemic may have varied since then, but also based on the location of where the respondent was and how great of impact COVID was at that specific time in that location. So for example, we had many responses from New York. At this time, the pandemic was really at its peak in New York. And so how New York looked at that time versus maybe a more rural community that hadn't seen a high rate of COVID cases yet may be very different. And so we know that this is a constantly evolving situation and that the impacts are varying across our globe. And we recognize that we do have the majority of responses are from the United States, so we have to be careful not to generalize this to all the other countries, but feel that there are some really good insights that we can learn. And we do have some interest in looking at sort of sub-analysis of this data to see if there are different unique factors or different themes that emerge from different regions, again, sort of depending on where the states and countries were at this point in time as it relates to the spread of COVID in those locations. And so we are hoping to do some sub-analysis to dive a little deeper into that. And then, these were really limited open-ended questions, but again, as Susan mentioned, we really felt it was important to keep this open-ended right now and not presume that we knew what the impact and challenges and opportunities were. And so we feel there may be some opportunities to do a follow-up that may have some more quantitative factors now that we have a little bit of a framework for what is happening and kind of see now that a little time has passed how things have changed and how people have continued to adapt and grow. So because we have such a large number of participants, we decided that we wanted to make sure we had an opportunity for everyone to provide some feedback and be a part of the discussion. And so this website link here is an opportunity for you to share your feedback on the survey. So we would ask that you please copy this down, and Tyler, maybe if you could copy this and paste it into the chat, that would be great, so people can just hyperlink to that right away. And then I'm going to share with you in the next slide what the discussion questions are. And we do have a little bit of time, so we'll probably take about 10-15 minutes to engage a little bit in discussion live here, but again, recognizing that we do have a large number of people, we're not going to get to everyone. We want everyone the opportunity to share their feedback through this survey. And so these are the questions that are in that survey that we're really interested in hearing from you today. So I'm going to read through all of them. And then if you see a question or have a comment or want to share on any of these, then we'll sort of open this up. If you want to post in the chat, and then if you want to unmute, if we call on you, then we'll kind of moderate it that way. But we're really interested in, first, what information surprised you? Was there anything in here that we presented that you thought was new or different or surprised you? And then what information confirmed what you already know? We also are curious to know what questions you have that this survey doesn't answer, and what stands out as the most important findings from our preliminary results. We're looking for input from you on what we should do as a result of knowing this information, who we should share this with, and what's the best way to share this information with others. And then wondering if you think organizations are continuing to experience these similar challenges and making these adaptations. And then finally, just your thoughts on, should we resurvey? And if so, what questions should we really focus on to get a pulse of how the pandemic is impacting organizations now? And then just kind of generally, if there's any other questions or comments you have regarding the survey. So I'm going to go ahead and move my chat box into view so I can see it a little bit better here. And so it looks like there might have been a couple questions. I'm going to back up in here to see those. And then if you have other questions or comments, please feel free to post those in the chat. And then when we get to that, if you want to unmute to talk live, you're welcome to as well. So I see Alfred said, we work with children living on the streets in Uganda. Is it possible to share some of the materials like magazines, videos, etc., so that we share them with the children? Currently, these children are in a temporary quarantine center for their safety and will be taken back home after lockdown. That's great, thank you. And we can definitely put that request out to our networks as well. So we'll copy that note down. Tyler, if I could ask you to just copy that and save that so we don't lose it in the chat, that'd be great. And Tyler did respond to that, thank you. And then somebody asked if the PowerPoint will be available. Absolutely, this is being recorded, and so we will send the recording and the PowerPoint out to all participants and also have it available on our website. And then we have someone from Sweden who said, new to this organization in Sweden, can I answer this with my colleagues over the next few days? Is that in the response to these questions, or are you interested in completing the survey again, Asa? Not sure if that might have been a private message. I don't know if you're seeing that. But if I'm not hearing anything back from Asa from Sweden, if you definitely can respond to the feedback surveys over the next few days. We'll have this open. We want people who weren't able to join the webinar live to have the opportunity to watch the recording and take that survey as well. And then Lisa Schneider said, as a part of the resurvey, is there a way to capture which new supports were utilized more often than others, and do organizations plan to continue new supports going forward, or are they a one and done? That's a really great question, Lisa. I think, now that organizations have found new ways and new venues of how to help, it will be interesting to see if people keep those services and support. So it's a good suggestion. And then thank you, Asaf. She said you'd like to answer the questions on Bitly. Absolutely, you can complete that survey anytime. And then we have Kathy from Canada who says, I think it is important to know if there are other government resources that are in place to help families. In Ontario, Canada, many families have government funds and they were changed to be more flexible and allow them to purchase iPads, use funds for grocery delivery and PPE, etc. This takes the pressure off of some respite resources. Wonderful. Kathy, is there anything else you want to share about that? Do you want to unmute or say anything else about that?
Just that, of course, many families have been very nervous to have someone come into their own home. So it's been a challenging time for families, but they've really appreciated the online resources. But we can see as summer is approaching that people are becoming more anxious to have that kind of one-to-one support for their family member to get out and be able to be more active and do things. And for us, the other pressure that we noticed was that in Canada, at least in Ontario, school was provided online, so families experienced a lot of stress having their kids with special needs trying to access support online for school on top of everything else.
That's a great point, Kathy. I know it was hard for me as a parent of relatively healthy, typically developing kids to homeschool and manage everything. I cannot even imagine how challenging that was for families who have children with higher needs, and also those who may still have been essential workers and have to be out, and how they manage that when so many services and supports were no longer available. So the next comment here is from Lisa McCoon. She says, I would love to know what shifts have been made since survey was taken. We have recalibrated our model several times because of the needs changing. As we look more toward the future, what have people done to innovate more permanent solutions? That's a great question. Lisa, is there anything else you want to share? If you want to unmute and talk a little bit more about that.
Hi, good morning. No, I think we've just, normally we're a pretty flexible program, and we are funded under an innovation grant. So we are constantly shifting to what the needs of the caregivers are. But typically that happens over a year or two. And we've recalibrated at least 3 or 4 times since March. And we're just seeing, I think like the previous attendee said, we're seeing a drop in the summer of people engaging virtually. In the beginning, it was a very crisis. Everybody wanted to talk about it. We were doing 2 virtual Zooms a day to connect, and then that sort of dropped off. So we went to virtual programming for the whole family to kind of engage connection. But we're even seeing that drop off, I'm sure, because of good weather and people being cooped up and having the opportunity to go outside. But our staff is now talking, what does the future look like? What are we going to do differently to make some permanent changes in our model? And we were just talking this morning about what are other people doing and what are best practices that people are coming up with. And I think it's really hard because there are so many unknowns, about COVID in general. And so, but we're trying to figure out just some more permanent solutions, knowing that we'll still have to be flexible. But our caregivers are needing that break. So trying to figure out what that looks like as a new normal.
Great. Thanks for sharing, Lisa. And where are you from? What region are you in?
I'm from Cincinnati, Ohio, United States.
Great, thank you. So we have a comment from Jackie. Results are very similar to our experience. Concerns now surrounding unclear guidelines on resuming work in office versus virtually, with concerns of a second wave. And we'll talk a little bit about that, something we are doing to help address some of that uncertainty around how to resume in just a minute. And then mentioned that funds are limited for concrete resources versus billing for care. Yeah, I think that's one of those bureaucratic concerns and constraints that many organizations I think are facing is, there's funding that is allocated for specific things. And if you can't get permission from your funders to flex that to other services and activities, that becomes a big barrier, I think, for many organizations. So Jackie, anything else you want to add or say from your comment?
Yes, I'm from the greater Detroit area, so we're just getting back into office soon, and we've adapted really quickly, I think, with very language barriers with most of our individuals that are Arabic and Chaldean speaking has been a challenge because many are impoverished to try and reach out with technology, but we have done a lot of creative stuff. I think that, similar to what you're reporting on, I think people really stepped up, but we were trying right before to expand and built this amazing center that now I'm very concerned about how we're going to offer the face-to-face kind of respites in a community setting that we wanted to, and the transportation to that. We're used to bringing sight impaired and visually impaired and hearing impaired individuals in a small van for technology seminars and all that. And how do you get them there now and have that distance that you need in transportation? So there's a lot of concerns. It's very, I very much appreciate though that you guys are looking into this and we can all brainstorm as we try and help people further.
Thanks so much for sharing. There's a comment from Anil. Says, great presentation, thanks, you're welcome. And the question, what percentage of carers are providing more care during due to the COVID virus outbreak? That's a great question. I know there are other surveys that are going on that are looking more specifically at the impact on caregivers, and we can definitely share some of those resources as those results are published. Connie says in a private message, it was mentioned about the challenges with also dealing with children schooling remotely. Was there any mention of children who were also caregiving and their needs for respite too? I did not see in the responses I reviewed anything specific about youth caregivers. I'm not sure, Susan or Tyler, if any of the responses that you reviewed, if you remember hearing anything that specifically addressed youth caregiving.
This is Susan. that didn't come across in the data that I coded, and I was a sibling caregiver, so I'm sort of tuned in to that as being a really important topic. But you know, again, we only know what people who chose to complete the survey told us, so we don't know everything that's going on. I'm betting that's an important thing to consider.
Yeah, I didn't see anything either in what I saw.
Yeah, great. So next comment is from Trisha Lazar. Excellent information. It suggests that as part of the resurvey, we might want to ask what are some of the specific adjustments made that have become the new normal, such as PPE, sanitation, etc., and what precautions will be used as we open. That's a great question. Trish, anything else you want to add?
Not necessarily. I'm just really interested in how we do continue to proceed forth. I mean, I know we're working together on you know, getting some examples for suggestions on what is safety precautions and how to safely provide respite or cares. You know, and what will that be moving forward? It'd be very interesting to find out how organizations are proceeding forth with the pandemic and hopefully looking into what can we do to prepare ourselves should something, you know, another wave come through.
Great. So I'm just cognizant of our time here, and I do want to take the last 5 minutes just to kind of close this out here. So I know there are some additional comments in the chat. We will review those and you know, take in that input. We also would really love for you all again to complete that survey to give us your full response and thoughts to the feedback, because that's really valuable and will inform our next steps as we move forward and try to figure out what to do with this information and how to continue to understand and support respite agencies in providing respite to families who, as we mentioned earlier, need it more so than ever. So in response to one of the questions, I'm really excited to tell you that ARCH has formed a work group that I'm helping to lead to develop national guidelines for providing and receiving respite care safely during the pandemic. So we are in the midst of this, trying to do it as quickly as possible, but balancing that with making sure it's a comprehensive, evidence-informed guidance document. And once that is complete, it will be available on the ARCH website, which is listed there. Some of the topics that we plan to have in there include, you know, really specific planning guidance on how to safely reopen. What are those considerations, sort of a walkthrough checklist, you know, how do you make that decision of how to reopen? And then different really tangible resources around safety guidelines and how do you train and support and adhere to the guidance around PPE, sanitation, and food safety, and then recognizing that there are many special populations in which this impacts them very differently. So having some of those considerations for those populations, and then some guidance on how to redefine respite. What are some other ways we can provide respite and be creative with our service delivery model and funding to ensure that people are still getting that break they need, even though it may look different than what we traditionally have been able to provide pre-COVID. And then finally, legal considerations, just recognizing that there are a lot of potential legal and liability issues surrounding all of this. So we wanted to address some of those questions and provide some guidance as well. So please stay tuned. We are hoping to have those complete in the next couple weeks here. So as soon as we have those available, we'll be promoting that broadly on our website, email list, and social media as well. But they will be ultimately on both the ARCH website and then linked from the Break Exchange as well. Next, I just want to mention a kind of fun thing we're trying to do to help get people a little bit more engaged in a positive way. We decided to launch a hashtag caregiving during COVID challenge. So we'd love for you to take pictures and encourage the people you work with to take pictures around what caregiving looks like for them during this time. So here's one picture shared here as an example. And the idea is that you would post and tag us on social media. And the picture that has the most likes by June 15th is actually going to receive a $100 e-gift card. So really encourage you and to share that in your networks to get more people engaged so we can just help showcase and bring some positive light to this situation that we're all in right now. And then as a reminder, those of you who completed the COVID survey but maybe chose not to complete the full Break Exchange survey, that full survey is still open and available, and we would love to have more responses to that. The purpose of this survey is really to get a global assessment of the state of respite care and use that to help identify best practices and how we can learn from each other. And so that survey is still open through June 15th, and the link is there for you. And again, we'll send that in the follow-up email as well. And there's lots of ways to stay connected to the Break Exchange. We have a Facebook page, a closed Facebook group that you can join for discussion. We also have Instagram, Twitter. You can always visit our website, join our email list, and again, complete that member profile on our website. And then anytime, reach out to our email if you have questions, concerns, or there's anything we can do to help support you in the great work that you're doing around the globe. So finally, I just want to end with this important reminder. I think we all in the world of respite know how important it is to take a break and to fill your cup. And so I just emphasize this not only in the essence of the respite we're providing to others, but in our own lives, recognizing that this takes a toll on us as individuals and our organizations as well. So please, I hope that you can find some time to fill your own cups and take care of yourselves so that you continue to have the energy to help support others in the great work that you do. So again, really thank you for taking the time to join us today. It was so great to hear from all of you, and we do look forward to continuing to stay engaged and hope that you all enjoy the rest of this day. Take care.